Hello and welcome, I'm Tefera Gedamu. In December of this year, Addis Ababa will be hosting the 16th International Conference on HIV and STDs in Africa. But what will the message be all about? My guests today, Dr. Yigeremu Abebe and Professor Sheila are here to talk about that. A very warm welcome to the program. I'd like to know why this conference is important. Essentially, I'd like to know why AIDS and HIV and STDs are so important. Have we done little to address those issues in the years past?
Okay, let me start with, I'll answer you the first part, why it is important. Then I'll let my chairperson answer the other parts, STDs in Africa. Well, this conference is important because this year, 2011, marks 30 years after the disease was first discovered. It also marks 10 years after the UNGAS, the United Nations General Assembly, the special session on AIDS, was initiated. And this was the first time the United Nations actually met on a particular disease. So that we are looking back to say 10 years later what has happened. It also marks 5 years after our political leaders pledged that they will now ensure universal access to prevention, treatment, and care and support, of people living with HIV, but also prevention of HIV. And indeed, it also marks 5 years after our leaders, our own African leaders, went to Abuja and pledged that in order for them to ensure that universal access to HIV prevention, treatment, care, and support, they are going to pledge 15% of each national budget towards health and HIV/AIDS.
That has never happened yet.
Well, it's really now a chance to be able to sit down and say, what have we accomplished collectively and individually as countries and all that? So that Ethiopia is very important for this year in the sense that it marks it has an opportunity now to be the very platform where decisions that are related to the 10s and the 5s are then made to say, how do we then carry forth this epidemic? What do we do in order to really stem the tide of HIV?
Yes. After AIDS was defined as a new disease 30 years back, millions have been infected, millions are living with the virus, and millions have died. And the epicenter of the epidemic, where you find the burden disproportionately, is in sub-Saharan Africa. Therefore, HIV and AIDS epidemic is not only a health problem in Africa, but it's also a problem of development because it affects the productive force. And now when we come to sexually transmitted infections, apparently sexually transmitted infections promote or increase the transmission of HIV, and the epidemiology of sexually transmitted infections, synergizes the spread of HIV. That's why these conditions, these health problems, are very important, especially for Africa.
But you keep on talking for years on end about putting this as an important agenda, but yes, you're still talking about it today. My question is, isn't that frustrating?
Well,
it doesn't seem that they are catching up.
I would say it's not frustrating in the sense that we are actually seeing progress. It has been put on the agenda, and actually our political leaders have acted on it. It's just that in some countries it's not enough, in others it's quite a lot. But I'll tell you what achievements have been made. And this, last year we launched the global report on AIDS, and on the 31st, the United Nations Secretary General launched the 211 report on AIDS. That was showing that in 22 countries of sub-Saharan Africa, the epidemic has actually gone down by more than 25%, meaning HIV incidence, especially among young people. So that is hope for us to say we will actually achieve an HIV-free generation. But we need to be able to work harder at it, because 22 countries is not enough. We have a lot more than that.
What do you think is a challenge?
The challenge,
It's interesting, is it not?
I would say the first challenge is political will and commitment.
So African leaders don't have
African
that
leaders,
commitment?
some have it, others don't. And they need to be able to then get together sometimes to see how far they have progressed, especially in that thing of devoting 15% of the budget towards HIV and AIDS. Not all of them have, but I'm also happy to say that even those who haven't reached that 15% are much better than in 2004, for example, when none of them had reached it. So that some used to devote only 5%, they are now at 11%. That's progress. It's not easy, but I think with the developments that are taking place, I'm hoping that they can then be inspired to say, look, this thing does work. We can have an HIV-free generation, because some countries are showing that it's possible to prevent mother-to-child transmission. In Botswana, for example, when I was Minister of Health, we rolled out services for preventing mother-to-child transmission, such that between 2004 and 2008, 4 years, we covered 100%. And we brought transmission from mother to child, the rate from 40% all the way to 4%. It's possible in other countries.
Yeah. I share Professor's comment, that political commitment is one important issue. In addition to that, in Africa, there are a number of priorities. HIV and is one thing. Even in the health sector, you have other problems such as TB and malaria. And out of the health sector, there are a number of problems such as education and so on. And poverty is another challenge. And, there are, poverty leads to AIDS, AIDS leads to poverty. Therefore, this is another challenge. And they have, the African leaders have been looking, outwards to get funds to control this epidemic. But still, there are many things they can do. They have to own, the response to HIV and AIDS. Yeah, and be committed and use even the available resources from outside in an accountable way, And therefore, there are a lot of things that the leaders, not only the political leaders, but other leaders too, and all segments of the society should do in order to curb the spread of the epidemic and its consequences. As Professor said, there are achievements in reducing the infection, in reducing deaths also. After the advent of the treatment, and millions of Africans could access and are living and improving their quality of life.
But doesn't that make those stakeholders a little bit complacent, because they think there is success, so they're proud of what they've achieved, but...
Yeah, I agree with that, but they can never be complacent while the majority of the people who need the services in Africa are not accessing. We have to build on the achievements, but we can never be complacent while a lot of people are suffering and dying of HIV/AIDS in Africa. And, how families are, disintegrating, and economic progress is, slowing and so on. The achievement is good, but it's not for complacency. It is to encourage further scaling up, the response and sustaining what you have achieved.
What do you think should be scaled up?
Well, everything. We have programs on HIV prevention. We have programs on HIV treatment, on caring for people living with HIV, and also on supporting, especially, orphans and vulnerable children. So that all that needs to be scaled. If we are seeing progress in terms of prevention, it simply means that in order for us to scale up, we need to really be able to ensure that every community has a very comprehensive program on HIV prevention, starting with male circumcision, condom distribution, talking about abstinence, fidelity, and also behavior change in general. So that it's really that when it comes to treatment, as he's already stated, we have 10 million people who are still awaiting treatment. We are very happy that we have been able to save lives, and in fact, we have managed to reduce by 25% the people who could have died. But there's still a lot to go. So we need to scale up treatment and ensure that it's affordable and it is accessible to a lot of community members. That way, we'll be able to save lives even more.
I'm surprised you didn't mention stigma and discrimination as one of the...
I was going to
Still
mention...
alive and well.
Yeah, he's still alive and well. But, scaling, what I found, even as a minister, has been that once you scale up services, the stigma goes down, because part of the stigma related to HIV was the fact that it was such a fatal disease. That's why people just thought, I don't want to die, so I don't want to associate with you. But now when people see people alive and well and really contributing to the development of that country, you find that the stigma goes down. But even that, we still have a long way to go, because there is still stigma and discrimination against people living with HIV. So that's why in the own up, scale up, and sustain, we want to ensure that all the punitive laws at country level are really minimized so that people can live and be able to access services freely without, any fear.
Own what? That's one of the mottos for the conference.
Owning is apparently for African leaders, not only the political leaders, but community, religious leaders, all segments of the society, the scientific community and all, should own the response to HIV/AIDS in Africa, should be on the driver's seat, and be committed and scale up all activities, as mentioned by Professor, not only prevention, but also the care and support, as well as treatment. This is what we mean by own. We shouldn't look outside only. First, we have to be committed, like the Abuja Declaration, where the government leaders committed to to put aside 50% of the government expenditure for health, and also community members should own. Then when we get resources like Global Fund and PEPFAR, these resources must be used very effectively, efficiently, and also in accountable way. This is what we mean by own. We are owning the problem. We should own also the response. And
how can you own the response when much of the funding comes from outside of Africa?
There are many ways of owning the resource. Mobilizing. Now prevention may not need too much resources. We can do a lot of behavioral change activities within our communities if governments are committed, if leaders are committed, if civil society organizations and NGOs and the private sectors in Africa are committed. We can do a lot even without the funds coming outside.
Can you generate funds from inside Africa? If so, what is the likelihood of doing that?
It's possible. You don't always need fund to change behavior. Of course, funds are very important, but at all levels there must be commitment. And to at individual level, individuals of course they have to be aware